So let's see the classification of antihypertensive drugs. Broadly, diuretics, renin-angiotensin system inhibitors, sympathetic inhibitors, calcium channel blockers, and vasodilators. So these are antihypertensive drugs, broad classification. Diuretics, renin-angiotensin system inhibitors, sympathetic inhibitors, calcium channel blockers, and vasodilators. In diuretics, we have further three classification: thiazides, high ceiling diuretics, and aldosterone antagonist. Okay. Diuretics में thiazides, high ceiling diuretics, and aldosterone antagonist. Thiazides, we have hydrochlorothiazide, chlorthalidone, and indapamide. Okay, so thiazides, hydrochlorothiazide, it ends with the word thiazide, then chlorthalidone and indapamide. High ceiling diuretic, furosemide, and others. Aldosterone antagonist, spironolactone and eplerenone. ठीक है, सो डायूरेटिक्स में तीन क्लासिफिकेशन है: थायाजाइड, एग्जाम्पल हाइड्रोक्लोरथायाजाइड, क्लोरथैलिडोन एंड इंडापमाइड. हाई सीलिंग डायूरेटिक्स में फ्यूरोसेमाइड एंड अदर्स, एंड एल्डोस्टेरॉन एंटागोनिस्ट में स्पाइरोनोलैक्टोन एंड एप्लिरेनोन. Then we have renin-angiotensin system inhibitors. In renin-angiotensin system inhibitors, we have three categories: ACE inhibitors, that is angiotensin convertase enzyme inhibitors, then angiotensin receptor blockers, and then direct renin inhibitor. So three categories in renin-angiotensin system inhibitor. First is the enzyme inhibitor, ACE inhibitor, then a blocker, then a receptor blocker, that is angiotensin receptor blocker, and then direct renin inhibitor. Aliskiren is a direct renin inhibitor. Aliskiren is a direct renin inhibitors. The ACE inhibitors end with the word pril, like captopril, enalapril, lisinopril, perindopril, ramipril, fosinopril, quinapril, and trendolapril. Okay, so the ACE inhibitors end with the word pril: captopril, enalapril, lisinopril, perindopril, ramipril, fosinopril, quinapril, and trendolapril. Okay, so the ACE inhibitors end with the word pril: captopril, enalapril, lisinopril, perindopril, ramipril, fosinopril, quinapril, trendolapril. In angiotensin receptor blockers, they end with the word sartan, like losartan, candesartan, valsartan, telmisartan, irbesartan, and olmesartan. Angiotensin receptor blockers end with the word sartan, losartan, valsartan, candesartan, telmisartan, irbesartan, and olmesartan. So remember losartan, valsartan, candesartan. In ACE inhibitors, remember captopril, enalapril, lisinopril. And aliskiren is a direct renin inhibitor. Okay, so in sympathetic inhibitors, we have four categories. One is beta adrenergic blocker, then alpha adrenergic blocker, alpha plus beta adrenergic blocker, and central sympatholytics. Beta adrenergic blockers, alpha adrenergic blockers, alpha plus beta adrenergic blockers, and central sympatholytics. Clonidine and methyl dopa are central sympatholytics. Clonidil and methyl dopa are central sympatholytics. Okay. Alpha plus beta adrenergic blockers, libitalol and carvedilol. Libitalol and carvedilol are alpha plus beta adrenergic blockers. Libitalol and carvedilol. The alpha adrenergic blockers are prazosin, terazosin, doxazosin, and phentolamine. Phentolamine and terazosin, prazosin, doxazosin. Beta adrenergic blockers are propranolol, metoprolol, and atenolol. बाकी कार्बिडोलॉल एंड लिबिटोलॉल आर अल्फा प्लस बीटा एड्रीनर्जिक ब्लॉकर्स. ठीक है. सिंपैथेटिक इनहिबिटर्स में वी हैव अल्फा एड्रीनर्जिक ब्लॉकर्स which are phentolamine, prazosin, terazosin, doxazosin. Then beta blockers which are propranolol, metoprolol, and atenolol. Then alpha plus beta adrenergic blockers which are carbidolol and libitalol. Clonidine and methyl dopa are central sympatholytics. Then the next category is calcium channel blockers. Calcium channel blockers have three categories: phenylalkylamine, benzothiazepine, and dihydropyridines. Okay, phenylalkylamine, benzothiazepine, and dihydropyridine. Verapamil is a phenylalkylamine. Verapamil is phenylalkylamine. Diltiazem is benzothiazepine, and the dihydropyridine end with the word dipine, like nifedipine, felodipine, amlodipine, clinidipine, lacidipine, lercanidipine, benidipine, nicardipine. Okay, so all these end with the word dipine. Dihydropyridines end with the word pidine, like nifedipine, nifedipine, amlodipine, felodipine, clinidipine, lacidipine, lercanidipine, benidipine, and nicardipine. Okay, so remember, amlodipine is a dihydropyridine, then nifedipine, felodipine, clinidipine. Okay, clinidipine, then 2 from L, lacidipine and licarnidipine, lacidipine and licarnidipine, benidipine and nicardipine. Diltiazem is a benzothiazepine. Diltiazem is benzothiazepine. Okay, and verapamil is phenylalkylamine. Then we have vasodilators, in which we have arterial dilators and then arteriolar plus venodilator. Nitroprusside sodium dilates both arteries and veins, so arterial plus venodilator are nitroprusside sodium. Hydralazine and minoxidil, these are arterial dilators. Arterial dilators are hydralazine and minoxidil. Okay, so broad categories were diuretics, renin-angiotensin system inhibitors, sympathetic inhibitors, then calcium channel blockers, and then vasodilators. Diuretics, three categories: thiazides, high ceiling, and aldosterone antagonist. Then renin-angiotensin system inhibitors, also three categories. Number 1, ACE inhibitors which end with the word pril, angiotensin receptor blockers which end with the word sartan, and direct renin inhibitor which is aliscrene. Sympathetic inhibitors, 4 categories: alpha adrenergic blockers, beta adrenergic blockers, and then alpha plus beta adrenergic blockers. Then we have central sympatholytics like clonidine and methyl dopa. And then calcium channel blockers have 3 categories: dihydropyridine which end with the word dipine, then verapamil which is phenylalkylamine, and diltiazem which is a benzothiazepine. Vasodilators, two categories: one which dilate only arteries, that is hydralazine or minoxidil, and nitroprusside sodium, it dilates arteries as well as veins.